So welcome guys to another episode, another video. Today we've got TJ with us, who's a third year dental student at Barts. So we're gonna find out all about what it's like being a dental student at Barts and what TJ found interesting about dentistry to end up applying for dentistry. So we'll find out about all of that and all the work he's doing with his podcast, YouTube, Instagram, everything. We'll find that out today as well. So thank you, TJ, for coming on today.
Yeah, I wanted to thank you as well for inviting me on and for even starting this whole thing. So I think, as we mentioned and talked about before this, that it's quite difficult to find the opportunity to learn. So I think this is a really good thing. And yeah, interesting to see where it goes.
Awesome. Thanks for that. But yeah, I like to ask the question, why dentistry? Why would you want to put yourself through that?
Do you want the answer now or the answer I had when I applied?
Both. Let's have both.
To be fair, I wouldn't say it's actually changed too much. So I'll tell you how I came across dentistry in the first place. When this is me just being brutally honest. So it came to year 9 where they were asking us to choose the subjects for GCSE.
Yeah.
And in my head, I was just thinking, I'm not entirely sure what I want to do, but I want to make sure that I don't cut off any career options this early on without even knowing. Yeah. So I wasn't sure what to do. So I went onto Google and I typed in highest paid jobs. And I was scrolling down this list, and yeah, this is being completely honest. And then I saw things like engineering at the top, and I was thinking, nah, not really for me.
Yeah.
There's some other things as well. Maybe lawyer was there. I can't remember. I was thinking, not really for me. Then I saw dentistry, and I was thinking, oh, maybe that could be something I'm interested in. So I did what most people did and went straight onto Google and searched a bit about it. And at that stage in year 9, which is quite early for most people, I was thinking, oh, dentistry might be something I want to look into. Yeah. And even from then, I think in around year 10 and 11, I was already trying to find work experience so I could get more insight into what dentistry would be like. Unfortunately, they had too many excuses for me back then about how I need to be insured and all this stuff. So I didn't get any experience back then, but that's where it first came from. And I think to answer your question, it was there. The main thing was helping people and having that like inner purpose and value that you bring into the community by having a skill which is so applicable to so many people.
Yeah.
And that sense of reward that you get from helping people. I think when I was younger, there was a bit more about like a bit of a status and financial freedom. I think the status is pretty much diminished now. I don't really care about that too much, but I think the financial freedom is quite important to me as well, because while dentistry is very important to me, I also have other things I like doing in my life as well. So I want to have a little bit of flexibility that I can follow my other hobbies and my passions and stuff like that.
Yeah. And would you say that your application process was straightforward? With any challenges?
No, I wouldn't say it was straightforward per se. In GCSE, to be honest, I'd say I've changed quite a lot. I was probably overconfident back then, and I was probably someone that didn't put in enough preparation. So GCSEs, I did okay. I didn't do terribly bad. I think there's a mixture of like A's and B's. Then A level, the grades were okay, but again, I was still a bit overconfident and underprepared in a way. And even going into the application process, I wasn't as clued up as I'd have liked to be. I think part of that is not having that many people around me that had applied to dentistry or knew the process of applying and knew the importance of doing certain things. So to give you an example, my personal statement is something that read quite well on paper, as in the words were nice and it flowed well. Yeah. But what I realized was that in terms of actual substance and content, if you strip away all the words, that I hadn't actually done that much, and I hadn't done that much work experience or that much volunteering. And I think that showed in my application process, because initially I got 3 rejections initially, and then Barts did reject me, but then they put me on the waiting list.
Yeah.
So at that stage, going into sitting my A-level exams, I didn't have an offer for dentistry. At that stage, to be honest, I was obviously upset when the rejections came in, but I was just holding faith. I knew that the most important thing was securing the grades. Yeah. So therefore, if I can secure the grades and then go in a gap year or whatever, and then apply again, that's fine, and I'll probably gain more from doing that, in fact. But then I was lucky enough on results day, I got the grades, and then I got an email from Barts saying that I've been accepted from the waiting list. So it all turned out well in the end.
Wow, so that's quite a rare story in that you know, on the waiting list you got your results, and then they got in touch with you to say we've got space. So did you actually go to an interview then for Barts?
Yeah. So that was my only interview. Barts is quite unique in the fact that it's a panel interview. So I didn't have to do any prep at MMI at all. I was just that panel. I think I managed to find on Student Room or something like that, there was a few different threads and chats, and some people mentioned the type of questions that Barts normally ask for. So I had an idea going in there and tried to prepare. And then, I went down to London, which is quite far from me to that interview.
Did you travel same day? Did you sleep over there? How did you approach it?
Yeah, so it was a same day job, and I think I was the first interview because it was like at least 8 or 9 a.m. or something like that. So I set up from here like 4 a.m. on a coach. Wow. So it wasn't too fun, but that's how it was.
Do you feel like you answered the questions well, and were you confident coming out of it?
I was confident for some of the questions that they went well because I prepared for them. There are some questions which I didn't answer too well, but that was just from lack of preparation, I guess. I think that's something about common diseases in the area, something like that. And I think I must have just answered something dentally related, but it turned out what they were looking for was tuberculosis, which is apparently rife in the Whitechapel area where Barts is. I didn't know that at the time, but yeah.
Okay, so you got your offer. You started at Barts. What was that like? Getting started at Barts?
Well, so because I got the offer on results day, which is in the middle of August, then being told that you have to move to London in 2 or 3 weeks was quite a rush and a shock. Even my mother wasn't expecting that I was going to be going all the way to London at that point. So it was like a mad rush, having to buy everything and get organized, the pots and pans, traveling and all that stuff. But then, I really enjoyed it. I'm glad that I went to Barts because, interestingly, on my work experience that I did, the dentist that I was speaking to, as his like last tip before I went off, he said, "Oh, by the way, if I say one thing is don't rule away moving far away from home." And I kind of kept that in mind, and that because all of the units I applied to were northern, Barts was the only one I applied which was far away, and that's where I ended up going. And I think I've learned a lot from moving that far away, and it's been a good experience. Yeah.
So I mean, you've experienced some years there now. What's been the difference between first year and now?
First year and now, So it's a bit weird. Every time from the place itself, whenever I come back home, because I'm from quite a small city, I kind of calm down and everything's settled again. But then every time I go back into London and I'm traveling on the train, I see all the monuments in the background. It's like, oh wow, this is the big city again. Yeah. And I'm still got lots of London to explore and finding all that out as well. Dentistry wise, I think again, before I applied, or before most people apply, you have an idea of what dentistry is, but you don't really know too much. But whereas now I'm starting to gain a feel for what it actually is, and I know that I like it, and I want to see more what it's about.
What's the course like in first year, and then second year, and progressing to final year? How does it set up? What's the structure?
So in first year, it's quite lecture dense. So most days will be in lectures, 9 to 5 or 9 to 3 or something like that. I think in first year we had a few clinics dotted around. I think we did polishing and plastic teeth, and I think we did like setting up the bay. About 2 or 3 hand washing. That was another one. So we did about 3 or 4 sessions, but it was pretty much lecture heavy.
Yeah.
I think Barts is actually one of the few. I think we did, our modules were biochemistry, neuroscience, systems physiology, and oral biology and stuff like that. So we're learning about all this pyruvate stuff back in first year. So it wasn't really, I wouldn't really call it dentistry, but like getting everyone on the same level in a scientific way.
How does it then progress from that? What's the progression?
So then into second year is when we start to learn more about the human body, human disease and pathology and stuff like that. And then it's our first real introduction to clinical practice as well, where we start learning stuff about caries and perio, topics like that. And it's the first year we start our actual first clinical course, so learning how to do fillings and search on plastic teeth. So that was the main thing in second year, really, was the transition to actually going into labs and drilling teeth, and then learning about human disease. Really.
All right. At what stage do you start to have that patient interaction?
So that's at the end of second year was when we got to screen our first patient, and then going into third year, we'd see that same patient again at the start of third year.
Yeah. So what? Talk to us about that. What's that? What's that like? Getting to see your first patient. What are you doing?
Yeah. So I was quite excited for it, actually. I think most people were, but there's also a sense of the confidence, not knowing exactly what to do or how you're doing it. So our first patient was just a screening. So basically, you get a patient that you haven't met before, and you have to just take a look at their mouth, do an extra oral exam, intraoral exam, and report your findings. And basically, you're trying to see what treatment does that patient need. And yeah, because I was thinking this patient could have absolutely anything. I wasn't really sure what to expect. But it was really fun, and I think the tutors are really supportive, and just knowing that you're there to learn, and no one's getting judged or anything, it just made it calm my nerves, and I found it really fun.
What's the environment like in terms of the clinics? Is it within a hospital, or is it outside of a hospital? What's the setup?
Yeah, so our uni really is based in the Royal London Hospital. So it has a dental hospital section there. So along with other people like postgrads and consultants that are in the hospital, there'd also be a section for undergraduate students. So that's where we are most of the time. I think in third year is when we started to progress into outreach clinics, but in second year, it was just in the Royal London.
Okay. Yes. So tell me what a typical week would be like in second year.
In second year, so I think it was, I can't actually remember how many days a week were in lecture. I think it maybe like 2 or 3 days, maybe a week in lectures. Then we normally have a seminar dotted around, which might be either communication skills or ethics or evidence-based dentistry, a small session like that. We normally have some sort of practical session. So if it was when we started our fillings course, it might be that, or other stages where we're learning the human disease clinical skills like cannulation, and taking blood tests and medical emergencies and stuff like that. So it's quite varied in second year. I'd say about 2 to 3 days of lectures, and then the rest of it was like learning practical skills.
All right. What's been the most exciting part, and what do you look forward to in dental school?
Yeah, I think the most exciting part was I think it was the first time at outreach, to be honest, because that was the first time. Because we had lectures in the hospital anyway, so we're kind of used to that environment. But the first time we stepped into a completely different place, it kind of gave that buzz and feels like, oh, this is what a dentist must feel like, and seeing a patient in a different place.
When you say different place, where is this?
So in third year, there's 2 different places we went to in alternating weeks. So 1 week would go to Barkentine, which is an outreach clinic in Canary Wharf.
Okay.
And then the next week would go to the Gutman Centre, which is an outreach centre in Stratford. So they were quite unique in their certain ways, because by Barkentine, you didn't have your own patients. People would come in that we need treating, and we didn't know which one of the students were going to see which patient. It'd be on the day allocation. So that was quite good in them. Like, if you didn't have time to prepare, obviously, you could have a denture fit or something like that, you'd have no idea. But that's how you learned the best. Whereas in Stratford, we're seeing our own patients there, and we're seeing the same patient regularly. So it was quite a good mix, actually.
All right. And what are you looking forward to at the moment?
Yeah, I'm looking forward to is really just doing the first of everything, because now going into fourth year now, in third year we'd passed several competencies. So taking teeth out and doing root canals we've done on plastic teeth and such, and even fillings. I'm yet to do my first filling yet, so I'm looking forward to all those first experiences of different clinical procedures to happen when I go back.
Yeah, and I mean, I know it's still some time away, but what excites you about becoming a dentist?
Yeah, so this is something which is like, it's changed, and it's still conflicting in my mind. I'm still trying to figure it out, because at the moment, I think things like cosmetic dentistry from social media and stuff is becoming quite attractive. But a part of me is still likes the hospital vibe and the hospital environment, and certain things like oral surgery and pediatrics and endo, where you're doing treatment to help get people out of pain. Yeah. I think it's something that is quite rewarding. I think it's something that's a little bit overshadowed at the moment, because in the public eye anyway, if I say I'm going to be a dentist, most people think about like veneers or whitening or something like that. And they don't really think about like oral medicine or oral surgery. So I'm thinking in my head that potentially it might be something I could explore. But then again, I also know it's very early days and I have very little clinical experience, so that can change.
Yeah. I know at the beginning you were saying that what you liked about dentistry was the flexibility and the ability to do other things. So what other things are you managing to also look into, and do you want to pursue together with dentistry?
Yeah, so being in lockdown at the moment, I've had time to kind of think about what I enjoy doing, and I've tried a few different things. I tried video editing for a while, and to be honest, I don't actually think it is for me, because I've now tried it. That's why I'd advise people to try different experiences as much as they can, even if they think this is definitely for me, or they think this is definitely not for me, just to try it regardless. Because I actually thought I would like video editing quite a lot, but then what I realized was when I was actually doing it and trying it out, that I didn't like it as much as I thought I did. And there's other things which I've tried which I didn't think I'd like, and then I've ended up liking as well. Such as like now I've been getting into fitness a little bit more. Yeah. I'm starting to really enjoy that side, and I never used to think I liked any sort of cardio, but now that I'm doing that more and more, I see that I actually do like that side.
Yeah. So just being able to explore different things and different interests and see where it takes you.
Yeah, definitely. I think a big passion of mine as well is sort of educating and giving advice to people that were in a position like me before. So that was probably a big reason why I started a podcast and I started running an Instagram page, is because I've learned a lot of things from other people that were on YouTube or podcasts or books or people in real life even.
Yeah.
And I want to use some of my time to give that back in a way.
Yeah. Yeah, no, definitely. What I'll do is I can put the podcast and Instagram on the description so people can check that out.
Yes.
And find you there as well. So tell me some exciting things that have happened with the podcast or the Instagram page. You know, what are some interesting things that you've experienced doing that?
Yeah, so I think going into it, I didn't really have a specific goal or how I wanted it to go. I just wanted to have fun in doing the process, and I kind of had it into my head that let's say the worst case scenario, nobody listens to it, nobody's engaging with it, that at least I would gain some certain skills from putting myself in some sort of sense of discomfort, because I wouldn't say I'm someone that's 100% confident. So being able to do something which made me feel slightly uncomfortable has in ways allowed me to get more confident, but also provided more opportunities where I'm getting to connect and meet more people that I never would have before.
Yeah.
So I think that's why, again, tying into trying different experiences and stuff like that,
Yeah.
you can never know exactly how something is going to manifest or how it's going to give back to you in the future. But just because I just chose to do it, and now I've grown in confidence and there's more opportunities that have come from it, and who knows where it's going to go in the future, that that part of it, the part of doing something which I didn't feel 100% comfortable about, I find quite exciting. It's like it's that bit of buzz. It's like that keeps me going, to be honest.
Yeah. And with that train of thought of personal development and self-development, how do you think being in dental school has shaped you or changed you as a person, or has it?
Yeah, so I always say dentistry is a bit of a weird one. So people always put like that picture. I think it's about splitting the word dentist into artist and engineer and doctor. And I think that's quite interesting because as a dentist, you need quite a large, wide range of skills. And I think it's quite rare for you to go to a dental school and find that the person that is the best communicator is also the best problem solver, is also the best person at memorizing, is also the best at time management, is also the best at leadership. So I think it pulls you and stretches you in quite a different number of ways. And I think that really helps you to grow and focus on any weaknesses that you do have and realizing what strengths you have as well.
Yeah. And what's helped you handle dental school? What are some things that, somebody who's starting dental school, what are some things that you think would be helpful to understand or to work on to make the process of dental school, as smooth as possible?
Yeah, so there's something I've been thinking about recently, which I think is worth sharing. So it kind of goes all the way back down to interviews where the interviewees, well, what's the purpose of an interview? Is it to find people that are able to be dentists in the future? Well, that'd be the ideal scenario, but there's so many more applicants than there is places available. So maybe more applicants would actually be able to succeed in dental school, but because there's not enough places, the interviewers have a very specific job. And as they have a list of skills that's required to be a dentist, and they're trying to find or screen for the best people in all of those areas, whether it be communication, whether it be academic ability, because they're all skills you need to be a dentist.
Yeah.
And I think it's a bit of a weird one because there's a slight discrepancy between performing well in an interview and having those skills. It kind of reminds me of exams. Exams are designed to make sure you know this information going forward. However, for an exam technique can sometimes just revolve in memorizing information without understanding it. And you perform well on the exam, but you're not actually meeting the aims of that exam. And the aims of that exam was to see that you're actually competent in the stuff. If you just memorize it last minute, then you don't actually know it, and it's probably going to come back to bite you. And where that leads to is what I was saying with interviews, is because they're going to say to you that you need to have communication skills, that you need to have leadership, you need to have commitment to dentistry. And it's quite easy to just say, okay, let me try and find these tick boxes to try and maximize my chances of getting into dental school. And I'm not at all like hating on anyone that does that, because I probably did the same as well, and I'd probably advise people to do the same as well. But I think it is worth zooming out a little bit and thinking, okay, why is this interview process trying to get me to have good communication? It's because as a dentist, you need to have good communication. Therefore, it's going to make your time easier in the future if you actually have communication. If you somehow blag to the interviewers that you've got this certain skill which you don't actually have, for one, it's going to catch up to you eventually when you realize that you're not very good at this skill and you need to be for the job. And so I think it's zooming out and knowing what's the purpose of each skill that they're doing, actually focusing on that, as opposed to thinking about just the interview. Think about the longer process of, why do I need to have good communication? It's going to help me in the future. Why do I need to have a commitment to dentistry? I think that's a good one as well, because a lot of people will get into dental school and it's going to be tough. There's going to be moments where you're thinking, this is really hard.
Yeah.
And you need to have that real actual commitment. But you could, in a way, do work experience at a lot of different places when you're applying to dental school, and then write down, I did 2 weeks in ortho, I did 2 weeks in a hospital, I did 2 weeks in practice, and really committed to dentistry, and I love it. But if you're just saying that for the fact of getting points in the interview, then that commitment is going to need to come back up again to get you through the hard times. So that was a very long-winded way of answering your question, but as my advice to anyone that's applying to dental school or is in dental school is to sort of think of what are the reasons behind all these skills, and how can I build those in a way that helps me not just get into dental school, but will actually help me succeed and flourish in a career as well.
Yeah. So how would somebody then take that a step further to say, I want to improve my communication skills. I want to prove to myself that I'm committed to wanting to become a dentist. So what would somebody do in the application stage?
Yeah. So the first thing is recognizing that it is important. So if you don't actually believe that the communication is important, then you're not going to get anywhere. So first, recognizing that it's important. Secondly is the learning stage, where you learn how to communicate. And that can be in two ways. You can either read content that other people are putting out there. Someone might say to you, communicate, you need to speak slowly, keep eye contact, stuff like that. Then you can also get that information, not just from reading it, but you can from observing people that you think are good at a certain skill. So I might say, oh, Dr. Arnold, he's really good at communicating. How is he doing that? And just looking and observing to see, oh, he speaks quite slowly when he speaks. Oh, he maintains eye contact. Yeah. Or he uses the person's name every now and again. So when you're communicating, you might say, TJ, I understand that you're doing this certain thing. And you might look at those things, and this is the learning stage. So you've recognized that communication is important. Now you're learning what makes you good at communicating. And then the final stage, which is probably the most important, is putting it into practice and going over it again and again. And you start to learn what you're not so good at and what you need to do. And it's like a muscle, like you're almost training it.
Yeah.
And you can't expect just from learning and seeing, just by seeing someone a list saying keep eye contact, that's not going to be good enough. You need to be able to practice keeping eye contact, because it's difficult for certain people, more difficult than others. Yeah. So you need to keep practicing that skill and really honing in and focusing on it. And then also doing the reflection part at the end after you've practiced it and thinking, what am I not so good at? What do I need to improve on more? Yeah. And keep going on from that.
All right. Do you find that dentistry takes up a lot of your time at the moment? Are you mostly thinking about dentistry, dental school, the future, being a dentist? Even when you're with family, does dentistry take up a lot of the discussions?
Yeah, I think it takes quite a big proportion, actually, to be honest, because it is something that I will eventually find myself discussing even when I'm at home with friends that don't study dentistry. I think it is quite a bit of a passion of mine, but I still like to make the point of trying to find other things in the avenues that can help reduce stress by like pursuing fitness as well, because I have a slight interest in that. Yeah. I could just shun it off and think, I just want to focus on dentistry, that's my career. But I think it pays dividends in ways that you don't expect by doing that. Fitness like helps reduce stress. And when you do something like fitness and then you come back, you find that you're also more focused on that dentistry because you've had a break from it as well.
Yeah.
I probably say it's a good 70% maybe of my life, but I like to have other things as well that I can focus on.
Yeah, it's easy to get very consumed by dentistry, and you have to make that conscious effort to also explore your other interests. Otherwise, that's all you'll ever do, and that wouldn't be healthy.
Yeah, 100%.
Yeah. If I was to ask you the question of what is dentistry to you in a sentence, how would you summarize it?
Yeah, that's a tough one. Let me think. I'd say dentistry is a profession which tests you in a wide variety of ways, but is extremely rewarding and allows you the chance to give back to the community and to people.
Awesome. All right. I hope people aren't stealing that as their lines for their personal statement now.
Yeah. Everyone's writing that down now. I should have said that. I want to trademark that one.
Yeah. But no, it's been a pleasure getting to talk to you and find out some of your dental journey or your story. And I'm sure this is just one of many conversations we'll have going forward. I've actually never met TJ in person.
Yes.
This is all social media, Instagram. So, you know, this is where we find ourselves, where we're making new connections online these days.
Yes.
Yeah, it'll be good to meet you in the future.
What do you say?
It'll be good to meet up in the future.
Oh, yeah. Let's definitely do it.
But no, thank you for coming on. And guys, make sure to connect with TJ. I'll put his details in the descriptions section. Subscribe, turn on those notifications, and
yeah, all of that.
Yeah, in the next video.